Super duper. Okay. Everybody ready over there? All right. Well, good morning and thank you for being here. Today we are releasing a follow-up report on nursing home inspections and staffing levels. We sent out a report on this issue in 2024, and we are happy to report that inspection rates have improved significantly. Iowa is now in compliance with the federal inspection requirements for our nursing homes in Iowa. This is fresh data released as of June 1st of this summer in 2026. And I believe it demonstrates what happens when government agencies are held accountable and have proper oversight. It's always good to have a little bit of encouragement to make sure that improvements are getting made. The Centers for Medicare and Medicaid Services indicate that as of June this year, nursing home inspections are taking place on average every 12 months. That's within the federal requirement of every 12.9 months, and much improved compared to the rate of 17 months back in 2024. The individual nursing home inspections have also improved. In 2024, 85% exceeded the 15.9 month requirement for each individual home, and that dropped to 2.8%. So that is also positive. We're also have improved upon neighboring states where the average interval inspection is 449 days. It is 360 days here. I think that this is largely be credited to staffing improvements. The number of individuals who are inspectors as state employees has been increased. More people can get more inspections done. Pretty simple. We also still face some challenges when it comes to staffing levels, and this is important to note. We do rank 47th nationally in the number of nursing staff per resident in nursing homes. In Iowa, a nursing home resident receives on average 1.3 hours of care from licensed nursing staff. The national average on that is 1.5, and turnover has improved among nursing staff, but it is still high. Nearly half of the nurses working at a certified nursing home quit their jobs in the last year. I think we're at about 44% right now. That still is, while that's high, it still is an improvement from prior when it was about 55%. There's also been a decline in the number of nursing homes in general, as well as the available beds. We now have 389 certified nursing homes. That's 17 fewer. So 17 have closed their doors in the last 2 years. The number of available beds has gone down by 2,000. And resident density levels remains low. So in the nursing homes that we do have, we have low numbers of residents, 52 per facility on average. That's the fourth lowest in the country. The only other thing I'll add is I think that the decline in nursing home questions is an important one, as obviously, as we see fewer of those, they're typically closing in rural areas where the population density is even lower to begin with. That can make it harder for folks in rural areas who need to be in a nursing home to have access to one in their community or close to their family. Happy to take any questions. It is. I think the easiest explanation for that is that the administration and the legislature invested in the issue and increased the number of staff at DIAL who are focused on, that's the Department of Inspections, Appeals, and Labor. They increased the number of staff that are devoted to nursing home inspections. So because there's more people doing it, because they've made that investment, that means that we are increasing the number of inspections that are getting done, and we're increasing how frequently they're getting done. Obviously, any parent who has told their kid they're expected to have a clean room and is able to take a look every now and then can understand why that level of inspections and that level of oversight is important. Because as the number of staff go up, then nursing homes themselves can count on someone coming in to actually check their work and make sure they're doing what they're supposed to do, at least as frequently as they are supposed to be looking into it. We couldn't give you hard data on that, and without hard data from this office, we wouldn't want to guess as to why. That would really be something that would be more impacted at the nursing home level, which is on the private side. We can talk about the inspector numbers because those are public numbers that we can see. If I recall right, the number of inspectors went from 22 to 32. We can double check that and get back to you. But as to why in the private nursing homes the turnover rate went down, we wouldn't have hard data that could back up any guesses on that. You know, in our 2024 report, we saw a very alarming level of lack of inspections. I think we were at 17 months on average in between inspections. We had some individual nursing homes going a very long time in between inspections. I think a piece of this, obviously, is a question of investment from the state level. If you want people in nursing homes, I own in nursing homes, to be taken care of and to make sure that those nursing homes are being inspected, I understand that there's a level of oversight, so they need to do a good job. You have to invest in doing that. It's not just going to happen on its own. And that's definitely something that the legislature and the budget has reflected by making increased investments in that has increased staffing. And with more people out there, you obviously can get more inspections done.
I know you mentioned, a lot of these numbers are doing better than they were before, but based on this report, are there still any areas where
I think we always want to make sure that we are improving, even when we're doing a good job. I think there's always, I think folks would expect and hope that their leaders would also be asking, okay, we're doing good, but how can we do better? The biggest concern here, I would say personally, would be the turnover numbers. Again, it's hard for us in the auditor's office to say why those numbers still are at 45%, but 45% is still very high turnover. We know that in general, direct care work in Iowa is, generally speaking, not particularly well paid. A lot of the folks that do work like this, not necessarily the workers in nursing homes, but people who do direct care work can get paid a very similar wage, sometimes a better wage, just working at a fast food restaurant. These are the people who are taking care of our grandparents and parents. They are bathing them, dressing them, feeding them. And so I think it's important for the state to be looking at what their job situations look like and why it would be that 45% of the people in those jobs are no longer employed in those jobs within the next year. That'd be my biggest flag, because in general, the more continuity you have for those people, the more they're able to establish a relationship with the residents in those homes. The more they establish that relationship, the more trust it grows there, the better care they're going to provide, the better care that's going to be received, and the fewer resources that the nursing home companies are going to have to put into training. Training itself is something that's expensive.
Sorry, the turnover rate.
You know, again, the turnover rate moved in the right direction. I think I want to emphasize that. It was at 54%. It's now at 44%. Glad to see that happen. But I think any of us would say if we worked in a job where 44% of our coworkers were gone within a year, that we would think that that was a high number.
I'm not sure if it's already mentioned, but do you know where Iowa's turnover rate is?
I think our turnover rate was higher. Let's see, I don't know if we had that in the report. We are this year. Yeah, so last year we were above average, and this year we're just on the low side of the average. Yeah.
Question online from what are the next steps to compensate football
That's a good question. That'd be a good question for the administration. We in the auditor's office always remind people that we are not in the wisdom business, we are in the integrity business. So rarely do you see us make recommendations about policy directions. We do it occasionally, but we do it when it has to do with integrity. And so what we do typically is look at whether or not policies are being acted and being followed as they said they would be. We do less of the work of suggesting new policies. Again, what I want to emphasize today is while we still have concerns about staffing levels in general, that we've seen the government inspection piece of this, the oversight piece of this, improve substantially, and that is a good thing. Well, let me put it this way. Not that we can include in this report, we include the decline in beds because it's something that we can easily verify. We know that it's true. What is causing a decline in bed availability would be more up to speculation. Certainly there are things that it's not all one thing. And we can certainly say that there are things that we could all acknowledge would be including it. For example, the number of people in any given area. As population density reduces in an area, as a rural piece of Iowa has lower population levels, it's harder for them to have residents and it's harder for them to have staff at the same time. That is a reasonable question. We did not dive into a review of every inspection and don't have an answer for that today.
Thank you.
Thanks, everyone.